a pleasure to be here to address the recent outbreaks of the H1N1 flu in California, specifically the impacts that it's had on our public education system. I'm pleased that the Centers for Disease Control has recently determined that the automatic school-wide dismissal of all of the students at a particular school need not occur with even the one confirmed or highly suspicious case of this virus. Clearly, in California, local health officials have the ultimate jurisdiction to close our school and to dismiss all of our students. I'm pleased that this new guidance, as more and more information becomes available and better known, will allow more of our students to remain in school on task, preparing for their successful future. I also appreciate greatly the initial concern for our school children and our entire staff at education that led to the recommendation of dismissing all of our students from any campus that had a confirmed or even a suspected case of this virus. CDC still wants, as you have heard earlier, all of our steps to be taken. Those steps, and try to repeat them all the time, to wash hands frequently, duration of at least 20 seconds with soap and water. If you're going to cough or sneeze, the students have taught me, Mr. Chairman, do the Dracula sneeze into your arm, kind of slowly into the crux of your elbow. And obviously, as has already been stated, if you're sick, stay home, including from school. I'm continuing to encourage our schools, our school districts to stay in close contact with local public health officials. We need to do an even better job of monitoring, as the chairman pointed out, the number of cases that we have, the number of illnesses, and we need to do a better job of tracking absences that also are directly attributable to the flu. If I might briefly, Mr. Chairman, I'd like to walk through the steps that we have taken during the last couple of weeks at the California Department of Education with our school community and our health community since the outbreak of the H1N1 virus. We did stay in very close contact with both state and local departments of health in California, with our schools, our school districts, including our charter schools. Within hours of the first alert of the H1N1 virus, my department issued a release to every school district about the precautionary steps that students need to take in order to make sure that they remain safe. We have numerous information available, posters, sample letters, easily downloadable to schools, how to prevent and how to secure through precautionary steps for our students and our staff to remain safe. And again, this is to wash your hands, posters, and how to sneeze, and if you're sick, stay home. We've also received some reports from some schools in California, Mr. Chairman, that the soap was not available in either some restrooms for our students and our staff. Clearly, that's unacceptable. We need to have soap or an alcohol-based hand sanitizers available at all times to our schools, to our students and our staff. We also developed at the Department of Education a special link on our website to keep school districts informed of those cases that we knew about, what schools were in fact dismissed, and also all press releases that were issued by either the educational community or the public health community in this area. And then just last Friday, we conducted a statewide conference call where we asked and invited each of our over 1,000 school districts to have the appropriate person online to talk and to ask questions to Dr. Bonnie Sorensen, who is a Deputy Director for the California Department of Public Health. Every school district and almost every county was invited. Every county was invited. Dr. Sorensen had an opportunity to brief school district officials on the latest guidance for potential dismissal of all students at their schools as it related to the H1N1 virus. Numerous questions were asked. Schools wanted to know the most recent information and also trends. As of Tuesday, just 2 days ago in California, 37 public schools had been ordered shut by local public health officials. And to make Congressman McKeon's point, that's 37 out of over 9,000 schools in the state of California. I believe our schools are much more relieved by the most recent guidelines by CDC and also California Public Health. We all understand that this clearly is an evolving process. Guidelines would need to change and update for more and more information. I've always stressed the importance of the school community to work closely with county public health because they ultimately have a final say on dismissal of students. I also wanted to share with you a major topic of concern for school districts. How would these school closures or the increase in absences when parents choose to keep their students home, fearing a potential impact, affect our state standardized test? This is the testing window in California today for our standardized testing, as well as the California high school exit exam. In California are trying to address this on a case-by-case basis. We're trying to make the accommodations necessary for the schools and school districts, and we are working with our contractors and our vendors. We've also communicated with the Federal Department of Education regarding this issue on how school closures would be impacted, for example, on participation rates, to make sure that we meet both our academic performance index and adequate yearly progress rates, and also reporting schedules. Some participation rates may in fact be affected by parents who just simply keep their kids home out of fear. The response from the federal department has been very, very helpful. They understand, very empathetic, and they've committed to work with us, and we're most appreciative of that. And then lastly, I wanted to make an issue too briefly, if I may. We need to have better communication between the field and our state offices in my department. I believe we do need to establish a system, really protocols, so that we know how many schools, how many students have actually been affected. We want to develop easy reporting procedures so that we can make better decisions based upon how many students we're actually talking about. And finally, Mr. Chairman, I believe that this issue also highlighted, in my opinion, again, a real need for school nurses, school health professionals at the school site. In California, as I mentioned, over 9,000 schools, 6.3 million students, over 330,000 teachers, and yet we have only 2,844 school nurses. That ratio is 2,227 students to 1 school nurse. That's one of the largest ratios in the country. Given the recent budget reductions in many local school districts, many schools have been left without sufficient healthcare professional personnel, and perhaps more school nurses could have helped us with early detection and even prevention. Again, thank you for the opportunity to be here. I greatly appreciate both the Obama administration and this Congress for helping us improve our educational delivery system throughout California and indeed the entire nation. Thank you, Mr. Chairman.